Welcome back. Again, we're talking about cubital tunnel syndrome today, and I mentioned about what it was. It's pressure on the ulnar nerve here on the inside of your elbow. And most of the time people will start having these symptoms of numbness or clumsiness or weakness in their hand. Oftentimes it occurs at night for a lot of people. The simplest thing to do is to keep you from sleeping with your arms curled at night. And you have two ways to do that. You can stay awake and keep your arms straight all night, or you can put a brace on your arm. It just hinders you from sleeping like this, because this is how most of us sleep, and you're fine unless you have this problem, and then that means that you're just going to keep choking your nerve. We like to do that for a number of weeks, even a few months, if this gradually fades out good, all right? But what if it doesn't? Well, then we look at whether the nerve needs to be decompressed in the operating room, all right, doing what we call a release. And sometimes that alone is enough. When we take away the things that are compressing the nerve, it gets better blood flow, symptoms get better, but sometimes the nerve is still tight on the back of the elbow. And usually I like to look at that in the operating room and decide if the nerve needs to be moved from the back to the front. And with that, we're giving the nerve a shortcut, so when you bend your elbow, it's in the front, so it's not getting kinked around this fulcrum at the inside point of your elbow. So that's one of the most common things that's done. Both of these are designed to what? Take the pressure off the nerve and increase the local blood flow to it. And that's an outpatient procedure. And if you do have it done, usually I don't immobilize patients. I like to keep them moving. Their hand is free. Lighter activities, put things up on the shelf, keep typing. But we would have you refrain probably for a 4 to 6 week window from vigorous activities. Anything that's going to traumatize that nerve in the early postoperative period. Once again, I'm Dr. Watson. I'm here at Colorado Springs Orthopaedic Group. Myself and Dr. Dale Cassidy are the hand and upper extremity surgeons here. If you feel like you have cubital tunnel syndrome or other upper extremity nerve compression problems, feel free to call us at 719-632-7669.